Chasing it. That's why we offer a skills-based education that helps move your career forward. Learn how to apply emerging technologies like AI and data science. Build your leadership and critical thinking skills. Apply by February 11th and save with no application fee. Learn more at umgc.edu. Certified to operate in Virginia by Chev.
Progressive's accident response can detect and send help when you need it most after a major car accident. But other accidents, you're on your own. Like when you accidentally call your wife Mom. When you accidentally say Happy Holidays on someone's birthday. When you accidentally wave at someone you thought was waving at you. We can't help with those accidents, but Progressive's accident response provides peace of mind after major car accidents. Progressive Casualty Insurance Company and affiliates. Limited availability in California. Driver is responsible for emergency and towing charges not covered by the policy.
The U.S. has dropped the number of recommended childhood vaccines. AP Washington correspondent Sagar Magani has more.
President Trump has complained American kids get too many vaccines.
Looks like they're pumping into a horse.
And last month asked his health chief to review how other nations approach their own recommendations and get the U.S. on par. The Health and Human Services Department now says immunizations like the flu shot are no longer recommended, but instead up to family choice. HHS Secretary Robert F. Kennedy Jr. says the move protects kids, respects families, and rebuilds trust in public health. Medical experts, though, say overhauling the federal vaccine schedule could lead to fewer kids getting important shots and more disease. Sagar Magani, Washington.
And I'm Marcela Sanchez, AP News.
This is Sarah Silver with your Fox Valley forecast, brought to you by Hot Hands, America's favorite hand warmers. Today, cloudy with a chance of drizzle and patchy fog before 10 a.m., then patchy fog and a slight chance of drizzle between 10 a.m. and noon. High near 42. Tonight, mostly cloudy with patchy fog after midnight and a low around 31. Currently, it is 36 and overcast. I'm Sarah Silver on the Talk of the Town, WRMN.
Are you 50 or older? This news is for you. The CDC recommends you get vaccinated against pneumococcal pneumonia. Even if you're healthy, your age puts you at risk. People 50 or older are over 6 times more likely to be hospitalized with pneumococcal pneumonia compared to adults 18 to 49. Just one shot can help protect you. Learn more and schedule at vaxassist.com. That's VAXassist.com. Sponsored by Pfizer.
Ready to tackle your junk piles? Call the Junk Luggers. From old furniture to entire cleanouts, we do the heavy lifting. And here's the best part. We rehome and recycle as much as possible to keep it all out of landfills. Feel good about your cleanout the green way. Call 1-800-LUG-JUNK or visit junkluggers.com today for your eco-friendly, stress-free service.
When it comes to orthopedic and spine surgery, Prime Healthcare St. Joseph Hospital in Elgin leads the way. Recognized by U.S. News and World Report as a high performer across multiple surgery types, we offer advanced and minimally invasive procedures supported by state-of-the-art imaging technology. Our expert surgeons and compassionate care teams are here to help you move, heal, and live better every step of the way. St. Joseph Hospital in Elgin, exceptional care close to home.
And welcome, folks, to the Community Hour here on WRMN AM 1410, broadcasting live here from Studio 14, serving you, the Fox River Valley area. I know we've got Danny Gilley here on the phone lines. We've been having a little bit of trouble with the phone lines here, so I'm going to see if I can get him onto the phone lines. Hopefully, it'll come through when we click it here. Hey, Danny, can you hear me? All right. Sounds like you're not coming through. If you want to try to give a call back, please try to do so. And then in the meantime, what we'll do is, if it doesn't work out, we can reschedule. So what we'll do is we'll just do kind of a community hour thing here too. But Danny, if you want to try to call back in, try to do so, and then we'll try to see if we can situate this. But what we'll do in the meantime is I'll read through some of the weather and temperatures that we have for the day today. It's going to be a high of 43. That's what we're seeing. Some early morning breaks in the overcast, otherwise cloudy. There's a slight chance of a rain shower. Otherwise, going to be mainly cloudy with a low of 32 for tonight. Hey, Danny, can you hear me?
Yes, I can.
There we go. We got you through the phone lines. All right, perfect. All right, so we'll get started.
Okay, well, this morning I like to say we have a little bit of rain out there, but anyway, I'm Danny Gilley from Medicare Made ABCDEasy, and we're going to talk about Medicare today and some of the changes for 2026. So first of all, let me get some information to you. Of course, the call-in line 847-931-1410, our reservation line. So if you hear anything during the presentation today and you want to give me a call back, schedule an appointment, or if you just have questions, call that number 630-320-6906. Again, that's 630-320-6906. Then, of course, our website, it's ddginsurance.com. So it's Dybvik Gilley Insurance.com. ddginsurance.com. And everything is on there. Matter of fact, if you would like to leave me a message, you can actually do it through the website, too. So to get started this morning, we're going to talk a little bit about some of the changes in Medicare costs. So let's talk about Part A. Now, Part A is basically the hospital coverage. It's a semi-private room, meals, general nursing, hospital services and supplies, all but the first 3 pints of blood. And that went up from $1,676 to $1,736 in 2026. Now, that's day 1 through day 60. Now, if you're in the hospital day 61 through 90, then, of course, that price is going to change because that goes to a per-day charge. It was to $419, it went up to $434. And then 31 days to 150, it went up from $838 to $868. And the first charge that was the larger one, that actually is a 60 days, so it's day 1 through day 60 of $1,736. Now, obviously, you go in January 1st, and you stay through January and all of February, then that constitutes that 60 days. Now, say you come back into the hospital in March, that 60-day copay starts all over again. So again, that would be $1,736 in 2026. And again, that would happen every 60-day intervals. So if you're the most unlucky person and was in the hospital 4 times in that year, and each of them during a 60-day increment, that could be pretty costly. If you stay in beyond the 60-day, and then that's when it's $434, beyond the 90 days, to 150, it's 868. So there are some major charges there. And I want you to keep in mind that if you don't have anything, you just have your red, white, and blue card. No Advantage plan, no Medicare supplement, nothing like that. And then also you have skilled nursing facility co-insurance. That co-insurance, days 0 through 20 is picked up by Medicare. Days 21 through 100, it went from $209.50 up to $217 in 2026. Now, there is some charges also for your Part B. Okay, so the Part B, let's get that up, pull that up. Part B monthly charge, that would be if you had a deductible, which it was $257. In 2026, it went up to $283. Now, how that works is that's a Part B deductible. So what that means is January 1, it starts, goes through December 31st, and then resets again the following year. That's not a typo. It is $283 annual deductible for the year for Part B. Then Medicare pays 80%, you pay the other 20%. So those are the changes that we see for the pricing as far as 2026. It wasn't a huge rate increase, but, every little bit does amount to a rate increase. Also, the one thing I want to cover this morning, besides the new rate increase, is the fact that there's going to be some changes in the prescription drugs, and we don't have everything available just yet. But what I have noticed is you do have that Part D, and the only requirement to have the Part D is you must be enrolled into Part A and or B. In other words, you either have to have Part A or A and B, okay? So permanently reside in a service area. Basically what that means, it goes by zip code. So, for instance, you can't take out a drug plan down in Florida when you live in Elgin, okay? So you do have to reside in a service area. Also, people who qualify for both Medicare and Medicaid, we would consider them dual eligible. And there is a higher premium for people who wait. So I'll give you an example. If you say, well, I'm not really taking any medications at all, haven't taken any in years, I think I'm just going to wait on enrolling into that Part D until I actually get some medications prescribed to me. Well, that is a big mistake, because right now there are some Medicare prescription drug plans out there that are zero premium. So anybody should have a prescription drug plan, even if you take the zero premium one. Because if you wait, there are penalties. It's 1% per month for every month that you don't have a prescription drug plan, and you should have had one. Okay, signed into law in August 16, 2020, and caps out the pocket of Medicare Part D costs at $2,000 starting in 2025, and 2026 it will be $2,100. So, give you an example. If you have some expensive medications and you run up a total of $2,100, you would not be charged anything else for the rest of the year. That's the maximum that you would ever be charged. So it is a good savings for people that are under some huge medications. Maybe they take a number of tier 3 medications, and the cost of that medication starts going up. Well, there is a little bit of a savings there that you can rest assured that the total cost would be $2,100 for the year. And that actually did change last year. And we did see a lot of clients that were on Part D drug and or they were also on the Advantage side that had the prescription drug integrated with it. And it was very helpful for those that actually needed some assistance with that prescription drug because let's say they didn't qualify for an LIS or a low subsidy, income subsidy. They didn't qualify for that. But this one came automatically. So that it was good, and it was something that was needed. And it did help out a lot of clients this last year. Now, the next thing I want to talk about before I get into the Advantage side this year, because there is an Advantage side open enrollment. But I want to talk about that after I talk about the Medicare supplement for just a second here. One of the things that we have noticed is a lot of the Medicare supplements have raised rates. I'm talking pretty much every one of them out there, but other than a couple that have raised rates astronomically. Now, if you were in a plan that, let's say, Plan F, for instance, we noticed that those premiums even went up even higher. One of the reasons is Plan F has not been available for a number of years now. So people that are on Plan F is basically the elderly people that have higher usages of the product. Then obviously you know how that works with insurance. Something that gets used a lot gets a higher premium. So if you are enrolled into a Medicare supplement plan and you are utilizing Plan F, do yourself a favor. You can go to Plan G, which is almost identical to Plan F. The only difference is that $286 annual deductible. Plan F pays it. Plan G, you have to pay it yourself. But if you look at the total premium that you're paying per month, you're probably in the area of $400 more in cost and premium over that plan G with you utilizing the Plan F. So by just switching from that Plan F to Plan G, you could see a savings of at least $250 a year. So do yourself a favor. If you are on Plan F and you notice the premium rates going way up, especially as you're getting older, give me a call because there is some relief for you out there. There's one company in particular that doesn't ask any health questions because I knew that's what you were going to ask next. Well, how about me? You know, I have COPD or I have more than 4 or 3 medications for any one ailment and I can't get coverage. Well, there is one company out there that does not ask any health questions. The premiums are a little bit higher, but I have noticed even if you utilize that company, it would still save you money if you're utilizing Plan F by just moving down to Plan G. Or you could even move down to Plan N, and that would even be less costly for you. Plan N, we basically would want to figure out, do you go to the doctor a lot? Because there would be no more than $20 copay for each doctor visit, a $50 copay for a hospital visit, but your monthly premiums can go down by at least $30, $40. So if you looked at the situation that you were in and you noticed that you're not utilizing your doctor visits that often, that also could be a way that you could save some premium. Now, if you're in the Chicago market, there's also companies out there that offer a hospital program where if you utilize the local hospital and it's been approved by your company, whatever insurance company you're utilizing, for your everyday services, not emergency, because emergency you can go anywhere, but for your just for your doctors that says you need to go in for a service or a test or something, by utilizing that hospital, then they would give you an additional discount. So are things out there available to you, and the good way to find out exactly what it is simply schedule an appointment with me. Call 863-320-6906, and I will go over all the options that you have with your Medicare supplement programs. Now I'm going to talk about the other open enrollment that is going on right now. So let's say you enrolled into a Medicare Advantage plan and you realized that the plan was not the right one for you. Maybe your personal care physician wasn't in the plan, or the co-pays were higher than what you wanted, or you noticed that you accidentally enrolled into a HMO and you were wanting a PPO. Well, we actually can make those changes. So to give you an example, if you were on an Advantage plan and you're not happy with that selection, you can change anytime in January, and the new one would be available for you in February. So you would enroll into the new plan sometime in January before the end of the month, and then it would be available for you in February. If you enrolled into it in February, then, of course, it would be March. If you enrolled into the plan in March, then, of course, it would start in April. But March is the cutoff date for that. All changes have to be made before March 31st for 2026. If not, you would have to stay on the original plan that you're on now. Now, there is another out that people don't even think about. A lot of times I notice that the agents don't even mention it to people going into an Advantage plan. But in an Advantage plan, you can use this only one time. But if this was the first time that you have enrolled into an Advantage plan, and let's say you were just turned 65 and you enrolled into an Advantage plan, or you had a Medicare supplement for a number of years, and then you enrolled yourself into an Advantage plan, and then you found out that that Advantage plan wasn't what you wanted. Again, if it's your first time that you've ever utilized an Advantage plan, you have 1 year that you can switch back to a Medicare supplement, or if you don't care to have a supplement and you just want your red, white, and blue, you can go back to your red, white, and blue, select a drug plan, and then that Advantage plan would go away. Of course, I don't recommend that. I recommend if you do drop out of an Advantage plan, you really do need to pick up a supplement and a drug plan. But that's only available during the first year that you have selected a Medicare Advantage plan. And anytime during that year, you can make that selection, go back to original Medicare, pick up a Medicare supplement and drug plan, and there's no health questions asked. So those are a couple options that you need to think about. So if you are out there and you find yourself in the wrong plan and you don't know what to do, you're kind of lost, well, January, February, and March, there are your outs that you can switch to another Advantage plan, one that that would service you better, and you can make that switch during the January, February, and March Advantage plan open enrollment. Now, if you wait beyond that point, and you wait until after March, then you will have to stay on the same plan that you are enrolled into for the rest of 2026 until the opening enrollment that comes up in October 15th through December 7th of 2026 with the start date of January 1. Okay, so I think what we'll do now is take a little bit of a break. And when we come back, there's a couple more things I want to go over with you. It's a new year, so, there are new things. And just want to remind you of some of the rules that Medicare has, so make it simpler when you do make those changes. So with that, I'll see you in a couple minutes after our break.
With your news flash, I'm Ryan Gatenby, brought to you by RainX. A state report finds hundreds of Illinois public employees improperly received federal pandemic relief funds, with some now facing criminal charges. The Inspector General says about 400 workers took nearly $3 million in loans meant for small businesses, often using false or fabricated claims. Illinois drivers should be aware of changes to Scott's Law. The Move Over Law will now apply to all emergency vehicles stopped or moving, and also covers emergency workers on foot. First violations carry a minimum $200 fine. As the new year begins, Illinois' minimum wage will not increase in 2026. The State Department of Labor says the minimum wage will remain $15 an hour for workers 18 and older, with the tipped wage staying at $9 an hour. I'm Ryan Gatenby with your news flash.
Billy, your gas light's on. We need to stop and fill up.
No way, Jen. Gas around here is too expensive. We can make it a little further.
Billy, listen to your big sister. You don't need to drive all over searching for the lowest gas prices. Do what I do and use Upside.
Upside?
Do you live under a rock, Billy? Upside is the hottest cashback app out there. It's free to download, and you get real cash back for every gallon of gas you buy. I use it all the time, and I've already made around $200.
You can make that kind of cash back just for buying the gas you have to buy anyway?
Yes, I'm looking at the Upside app now, and there's a gas station at the next exit offering 25 25 cents per gallon cash back.
Okay, I'm stopping to download Upside and fill up my tank. Download the free Upside app now to earn cash back every time you buy gas. Use promo code TOUR25 for a limited time and get a 25 cents per gallon bonus on your first 2 fill-ups. Cash out anytime right to your bank, to PayPal, or a gift card for Amazon and other brands. Just download the free Upside app and use promo code TOUR25 for a 25 cents per gallon bonus on your first 2 tanks. That's code TOUR25 for a 25 cents per gallon bonus on your first 2 tanks.
Get ready for an unforgettable night out in downtown St. Charles at O-Shows, where live music, dining, and entertainment come alive. Visit the iconic Arcada Theater at 105 East Main Street and experience the venue voted Chicagoland's premier entertainment destination. Whether you're enjoying a headliner concert, dining at Rock and Ravioli, or hitting the speakeasy at Club Arcada, O-Shows creates memories. Tickets and event info at oshows.com, and you can call 630-962-7000. That's 630-962-7000. Make your reservation, bring your friends, and plan your next event at O-Shows. Live music, dining, and entertainment, all in one place. Visit oshows.com and join the fun tonight. Supporter of the America's First Responder Fest.
This is Sarah Silver with your Fox Valley forecast.
Brought to you by Chick-fil-A.
Today, a chance of drizzle and patchy fog before 10 a.m., then patchy fog and a slight chance of drizzle between 10 a.m. and noon. Cloudy with a high near 42. Tonight, patchy fog after midnight. Mostly cloudy with a low around 31. Currently, it is 38 with clear skies. I'm Sarah Silver on the Talk of the Town, WRMN.
The second I see that Chick-fil-A text in the group chat, I'm throwing my shoes on and running out the door. Hey, I'm Layla.
And I'm Kaylin.
And a little thing we love about the Chick-fil-A chicken biscuit is
how it feels like an easygoing morning.
The chicken adds the most flavor. It's juicy and seasoned.
The biscuit is just very light and airy and fluffy, just like a cloud.
I also love to put jelly on mine so it's sweet and savory.
It's a good start to the day.
Mornings are a little bit brighter with the Chick-fil-A chicken biscuit and Simply Orange Juice. Available on the Chick-fil-A app. Real guests paid for their testimonials.
And welcome back, folks, to Medicare Made ABCDEasy. We've got Danny Gilley here on the phone lines with us, continuing on this next segment of the 9 o'clock hour.
Okay, let's talk about, if you would like to place a call in for today, the call-in line is 847-931-1410. Again, 847-931-1410. Our reservations line, 630-320-6906. And our website, dvginsurance.com. Okay, so we kind of talked about a little bit about Medicare supplement, the fact that the supplements do cover some of the expenditures that Medicare doesn't cover. We also talked about Advantage plans, the new that you have the first 3 months, January, February, March, to make changes if you need to. So now I'm going to bounce back to the supplement. And because there is a question that I get from pretty much every client out there that enrolls into a supplement. And then they think that the Medicare supplement, the only time you can make that change is during the open enrollment period that is October 15th through December 7th. Well, that truly is not the case. The open enrollment, the annual enrollment period in Medicare only pertains to your medication, prescription, drug plans, and also your Advantage plans. During that time of the year is when you can make the changes into either one of those plans, starting on October 15th and goes through December 7th. After December 7th, obviously, if you Whatever prescription drug plan you are on at that time will continue on for the next year. The Medicare Advantage plan, they still give you that January, February, March open enrollment for Advantage plans. Okay, so one of the things that people misconstrue, that they can only make that change on their Medicare supplement plan during that annual enrollment period, and that's not true. You actually, if you have a Medicare supplement, you can make those changes any time of the year that you so desire, and as many times as you like. There are no limitations on that. The only limitations that you're going to find is usually if you're outside of your initial enrollment into Medicare, with that 6-month initial enrollment, once you're past that point, then you will have to answer some health questions. And the insurance company can say, no, thank you, we don't, you don't qualify, you have some health issues. Again, not every insurance company has the same criteria as far as the knockout questions or something that would preclude you from getting that Medicare supplement. So when you start looking around and you get a decline from one company, that doesn't mean that you can't try a different company. Okay, so another thing that comes up constantly is the fact that they say, well, you know, I heard such and such company has the best supplements out there. And I had to take a drink here. I was getting a little dry. Unfortunately, that's not how that works. Now, right now, you're looking at probably 3 different plans out there. Basically, it's going to be Plan N, and that's where it's a part of a copay structure, where you have no more than $20 per doctor visit. Doesn't matter if it's a specialist or a PCP. $50 copay for emergency room. And, of course, you will be responsible for the charge for excess charge as far as the supplement factors are concerned. We don't see that too much not on a regular basis, but every now and then we run into that, where the doctor, maybe a surgeon that you want to have to do your surgery, and he says, I'm not part of the Medicare, but I will accept Medicare assignment. The only difference is I get to charge you 15% more. In that particular case, you would have to pay that because your Plan N does not cover that portion. Plan G is almost identical to Plan F. The only difference is that $283 annual deductible. Other than that deductible and your monthly premium, that's all you would have to pay. You could run up $1 million claim, and you still would have to only pay your monthly premium and that annual deductible. Plan F is no longer available. If you are in a Plan F, again, that's when I tell you that's a plan that you want to get off of because the premiums have skyrocketed. Now, when I hear a client say, yeah, but, you know, I heard that this insurance company has the best supplements out there. Well, I'm going to tell you the same story that we utilize when we do the seminars. I want you to just pretend that Medicare supplement is a can of Coke, okay? And we're just going to use Plan G, for instance. So that Plan G is a can of Coke, okay? Now, when you go pick up that can of Coke at the drugstore or Mariano's or Jewel or even Walmart, that can of Coke that you pick up is not being bottled in the back room. That actually is delivered, and then a big Coca-Cola truck comes and delivers that can of Coke to those grocery stores, and then they sell it. Now, the difference is each store may have a different pricing on that can of Coke, okay? Well, this is actually what Medicare does. Medicare is like the truck that delivers that can of Coke. Medicare delivers that Plan G or Plan N or Plan F, delivers that to the insurance companies to sell. Now, the only difference is each insurance company may have a different pricing structure based on their experience level. So, what we have noticed is traditionally there can be a few dollars between all of the A-rated companies. This year, for some reason, we have found that we do have one company that has an A rating, but has a much better premium than what some of the other companies have. And their underwriting process is pretty simple, too. So when I have been getting tons of calls saying that, gosh, I just got a rate increase of $65 on my Medicare supplement. Is there something that you can do? Yeah, there is. So what we do is we look around to find out if there's another insurance company out there that I can enroll you into. Obviously, you're going to have to answer health questions. There's only one company out there that they offer that Plan G or Plan N or even the Plan F without any health questions. But traditionally, that company is a little more expensive. But in some cases, a person that has been on that same different company for a number of years and have gotten numerous rate increases, maybe that plan is still cheaper. So don't feel that you have to accept those huge rate increases. There are things that we can do. We can check around at other companies and see if their price structures are a little bit changed in pricing. And I will tell you this year, there has been a number of companies out there that do have a lesser price structure than some of the other companies. And that usually doesn't happen, but this year it has happened that way. So if you are in one of the companies and you notice this $50, $60, $70 rate increase, do yourself a favor. Give me a call at 630-320-6906 and let me see if I can't save you some money and help you out with that higher cost. It's not a guarantee because you still have to go through underwriting, but not every company has the same underwriting structure. So the chances of us finding something out there is good possibility. Obviously, if you just had a major surgery or you're in the process of doing some diagnostic work, chances of us getting you moved at that point in time may have to take a little bit of a wait. When you're done with your rehab and you get a good clean bill of health from your doctor, then we would move on and try to get you moved over at that point in time. But there are things that we can do out there. So don't feel like you're stuck and that you just have to stay there. Especially if you're like a lot of my clients that are on supplements, they don't care for the Advantage plan because maybe they like that freedom of choice. With the Medicare supplement, you can go to any doctor, any hospital in the United States that takes Medicare. Well, every hospital takes Medicare, so that one's a given. But all you have to do is, I tell my clients this all the time, if you're going to a new doctor, the only question, the supplement is connected to your red, white, and blue. So don't call the doctor and say, I've got this Medicare supplement plan. Do you take that? It doesn't matter. All you have to ask is a simple question. Do you take Medicare? If they say, yes, we do, you don't have to worry about the supplement. It's already accepted because the supplement is part of Medicare. So another thing that customers get confused with, when you go to the hospital, they're going to want to see your Medicare supplement card and whichever company that you're using with your supplement, your red, white, and blue, and your supplement card. They'll want to see both of those. And here's the reason. Okay, so, you think sometimes I've had this question asked, well, I think this company pays better, the Medicare supplement plan pays better than the other company. And let me explain how it works. Okay, so Medicare is your primary. So you go to the hospital, you go to the doctor, and so Medicare makes the determination. So they decide what portion that they're liable to pay, and they send a check to your provider. Then they automatically send a notification to your supplement company telling them exactly what they have to pay. Then they pay your provider company that amount of money. They don't have the choice to say, no, I'm not going to pay that. Medicare makes all the determinations. In choosing the Medicare supplement, you're still on original Medicare. And so what Medicare basically has in place is it has to be medically necessary. That's one of the big rules. It has to be medically necessary. So obviously, anything that's medically necessary is going to be pretty much approved by Medicare. So Medicare makes that determination, not your supplement company. The Medicare then tells the supplement company, if Medicare approves it, the supplement company approves it. If the Medicare doesn't approve it, the supplement company is not going to approve it. So it's pretty simple. Medicare is in total control, and you can go to any doctor, any hospital in the United States. So give you an example. Say you had something going on and you really felt that you wanted to go to Johns Hopkins, because there's a doctor out there, Johns Hopkins, that specializes in this one, whatever the issue that you have. You can take that supplement along with your Medicare card. You go to Johns Hopkins. You're covered. And in this area, Northwestern, Loyola, any of those hospitals, it's your freedom of choice is what you have with that Medicare supplement. Now, with an Advantage plan, it changes. It's a whole new world. Some people like the Advantage plans, and some people don't. The big difference in the Advantage side, you want to make sure that you understand how that plan works. Now, most of the Advantage plans are at zero premium. So basically, excuse me, all they're getting for their services is what Medicare pays, okay? So how is the other charges going to be taken care of? Well, obviously, it's a copay structure. So if you go to use an Advantage plan and you go to a specialist, well, there's going to be a special charge for every time you go to an Advantage plan or a specialist. Have an MRI. Yeah? There's going to be a fee to have that MRI done. If by chance you diagnosed with cancer and you have you need an MRI, you need a CT scan, you need radiation, you need chemotherapy, there's copays on every one of those. The only thing that you can look at is in the PPOs, basically there's and HMOs, there's a maximum out of pocket. So once you hit that maximum out of pocket, then you don't have any more copays. It's 100%. If you utilize HMO, you cannot go outside the network. If you utilize a PPO, you can go outside the network, but if you do, all those copays are usually double than what they were, and that maximum out-of-pocket doubles. So I want you to think when you're making that decision between that Advantage plan and that supplement. And the reason why I bring this up a lot right now is because we just went through this with open enrollment. And the advertising that you hear on TV or radio, and they talk about, oh, you get this free, you get that free, almost everything. You'd think that, oh, this is one of the best things that ever happened. I can't believe they're offering all these freebies. Well, what they did, this is so close to false advertising. What they did is they took all of the freebies that each company may offer, tied them all in together. But then in the fine print, it says not available in all zip codes. So unfortunately, that's how they get by with putting all this information into a advertisement. Unfortunately, some people fall for that. And then they do end up enrolling into this Advantage plan, and they find out that it wasn't what they thought it was going to be. Now, I want to be honest with you. There are some of my clients out there that take the Medicare Advantage plan, and they love them. But I want to ask you a question, and I say this with every one of my clients. Okay, do you have a crystal ball? Do you know in 5 years what it's going to cost you? Okay. Obviously, as you get older, guess what happens? You use more medication. Okay, now you're going to the doctor more often, and all of a sudden now you're seeing more specialists. And I can tell you this from personal experience. My age now, I'm going to more doctors than I ever have in my life. But, of course, that's part of aging. Unfortunately, in some cases, if you're wanting to move from that Advantage plan to the supplement, remember I told you that you had to utilize the health questions that each company has. There's only one company out there that you can get a supplement with no health questions, and those premiums are about 25% higher. So when you're out there and you're saying, well, I want to save money, so I'm going to go to this Advantage plan, and I'm healthy as a horse, I only go once a year to the doctor, that may be the perfect plan for you. But always remember, it's kind of, as you get older, you tend to use the program more. And at some point in time, you're going to look at that Advantage plan and say, okay, it worked okay for me when I was younger and I was healthy and I wasn't utilizing the doctor as much. But you don't have a crystal ball. So that's the reason when I talk to my clients, I explain to them how that Advantage plan works, how the supplement works, the freedom of choice with that supplement, and networks in the Advantage side. So you have to utilize certain doctors that are in the network. Your PCP doctor may not be the same as your specialist. So you are taking your healthcare dollars and you're moving them around. So you just want to be careful. Like I said, I have some clients on the Advantage side that just love them. And, that's perfect. They're perfectly happy. But I also have some that were on that Advantage plan, and now they're trying to move back to the supplement, even though it costs them a little more now, but they like that freedom of choice. So there's a lot to making sure that you are making the right selection. Now, my job is not to make that selection for you. My job is to only give you the good, the bad, and the ugly on both plans. I want to educate you. That's my job. Educate you as to what you're purchasing. Okay, it's like if you go buy a new car, you don't know what all the options are on that new car, and chances are you wouldn't have an idea of what it would do. You take that new car home, it would take you 6 months to figure it out. Well, in healthcare dollars, you don't have that kind of freedom. You can't take that 6 months, especially if you get sick with something immediately once you get that insurance policy. So you need to understand exactly how these plans work, how the company, whether it's Medicare, where it's basically on Medicare, it's medically necessary. Now, and the Advantage plans, the insurance companies are making those determinations for you. Yeah, there's appeals that they turn you down on maybe on a procedure that you need. You can't appeal it. You know, like I said, there's some options and some pros and cons with each of the programs. But I want you to make sure that you understand exactly how each one of those programs work. Well, I think I'm going to have to call it a day. My reservation line, 630-320-6906. And, of course, vdginsurance.com. And I will be here the first Tuesday, in February. With that, I appreciate it, and thanks for listening. Bye-bye.
Thanks, everyone, for tuning in to a Medicare-made ABCDEasy by Dybvik and Gilley. Insurance made ABCDEasy. Up next, WRMN 10 o'clock news segment.